Okay, the question is, what do you think about marijuana for the treatment of pain? It's going to put me on the spot here. Um, the answer is, I don't know. Um, First of all, I've never been in a state that medical marijuana was legal. Um, and when I was actively practicing, we could use THC for certain things, but which is the active ingredient in marijuana, but we weren't allowed to use marijuana. I've never been in a state that medical marijuana dispensaries were available when I was in active practice, and um, I'm very dependent on other people that have more experience on this, and we do have open discussion groups and about herbal products, and often marijuana comes up, and we have people that give us their opinions. I can say that medical marijuana is now legal, I think, in 18 states in the District of Columbia. I may be wrong, but um, THC is the active ingredient that most people are interested in, and THC is legal, FDA approved since I think 85, to treat nausea, loss of appetite, failure to thrive in patients that have things like cancer and AIDS. And I've utilized it there, and it's been very effective in regaining appetite and helping individuals not have significant nausea. The people that I know a lot about neurology, and the cannabinoid system has been found to be the most ubiquitous system, the biggest system in the nervous system, receptor-wise. And there's a lot we don't know about it, and we're learning. I can tell you that it makes sense that marijuana has properties that may help certain pain syndromes, especially nerve pain syndromes. Now, setting aside the controversy that marijuana is not legal everywhere, and that the federal government has it as a controlled substance, there is strong evidence that medical marijuana has this effect on nerve pain, particularly caused by multiple sclerosis and HIV and certain peripheral neuropathies. It also may really be good for people that have complex regional pain syndrome, which is a sympathetic mediated pain. It makes sense that it may help with that. It also may help with people that have certain syndromes like arachnoiditis and severe syndromes that by increased anxiety, increased emotionality, you can have increased pain, nerve pain. But I don't know of a lot of research except for some that's been done at Johns Hopkins, and most of that shows it relieving nausea and help people suffering and side effects like chemotherapy and cancer. I'm open to hear more from everyone. Now, marijuana does have risks. The THC tablets are dosed specifically. When you deal with marijuana, you're getting it from different places, and in the past, you didn't always know if you're getting the same dose. You had to control your dose. Now, I've heard that's beneficial from experienced users. They know how to dose themselves. They know which product does what. But I've also heard that more novices and more intermediate users do not know how to dose themselves, and then get into trouble with certain, kinds of marijuana, and they need guidance. And I'm not aware of the marijuana dispensaries. I've never even known anyone for someone, so I don't know how much guidance they get. And I welcome any comments on any of our discussion groups about this. We have an herbal discussion group coming up in October. That's going to be a teleseminar, and then we usually have about an herbal one almost every month. So if anyone wants to get in on that and help us out and give us some practical advice, and speaking of practicality, there are serious problems with marijuana. Some people can become addicted to it, and also there's psychosis and serious neurological and psychiatric consequences to marijuana in certain people. Every drug, every herb can cause problems for certain individuals. So I see a lot of, as with the stronger marijuanas, I've heard there's a lot more potential for side effects. Now the other thing is there's a whole lot other than THC that needs to be studied about marijuana. There's a lot of new therapies and cannabinoids. There is anti-seizure being looked at. There's all kinds of anti-pain. There's not just nausea and the typical pain. There's all kinds of things that are being looked at now. It really affects the neurological system, GI system, etc. So now, lastly, on a practical level, you need to be aware of the laws regarding the use of medical marijuana in your state. You could be arrested for smoking marijuana just by going over a state line. So talk to your doctor. There are prescription drugs available that have THC that are FDA approved and been around quite some time. And I think they're very valuable and very valid. I don't know if that's the best answer for you. There needs to be a lot more research in this area, especially now that we know how ubiquitous the cannabinoid system is and how important it may be to the neurological system. And I welcome anybody else's input. Does anyone else have anything to say? Everybody else is terrified, right? So nobody wants to be on the recording. All right. Well, that's it for today. That's the last question, and take care.